looking for like weight loss procedures and stuff, people come in and say, I want liposuction because I want to lose 50 pounds. Is that legit?
No.
I figured.
Now, you can take a lot of volume out of someone,
right?
But it can be dangerous. So whenever you are taking out fat, you're also taking out blood and fluid. And our body really tightly regulates fluid. So if you're going to take more than 4 to 5 liters of what we call lipoaspirate, right, which is a combination of fat, blood, and fluid, you really need to be in an overnight facility and you need to have your vital signs monitored. And it's very unfortunate that somebody has a complication from that. I mean, you can get very dehydrated. Those fluid shifts are bad. The most severe thing that can happen is swelling of the brain and herniation of the brain, and that's death, right? So a lot of states have a limitation of what you can take in terms of volume in the office. And we in our practice do office-based surgery, meaning you will go home after surgery. So we like to keep it, or at least I like to keep it at 4 to 5 liters max, just to make sure that it's really, really safe. And I tell my patients how to hydrate prior and after and what signs to look for. Okay. But if you're somebody who really needs a higher volume, you might really need to lose weight before surgery. And I think people are more successful if they're close to their goal weight. And so that you can get the contouring for the liposuction. Right. Or if you really need a lot more volume, then you need to go somewhere where they have an overnight facility just to make it safe. But when you think liposuction, think body contouring, thinking about resistant areas where diet and exercise can't hit.
Now, is there an ideal candidate for liposuction versus switching and saying you really just need skin tightening?
Yeah, I've had a lot of young women who have concentrated areas in their flanks or maybe in their bellies, and they are active, they are of normal BMIs, and those are patients for which liposuction is really great, and they do phenomenal. They have amazing results. And then there are people who have some skin laxity. They've had maybe pregnancies, they have striae or stretch marks. And any skin that has had stretch marks, it doesn't have the same elastic recoil. It's not going to bounce back. It's a permanent break in the dermis. So for those patients, they might be a better patient that's suited for a tummy tuck. Right. Because they need that skin, especially in the bottom portion of their belly, to be removed. And a combination of liposuction and tummy tuck is a great procedure for the right patient.
Well, I'm not gonna lie. I have multiple treatments with liposuction, and even though I've worked in plastics in the past, I am that person that got on the scale the next day to see if I lost any weight.
Oh, so I had liposuction too. My plastic surgeon is phenomenal, and she is one of those pioneers in doing things under local anesthesia. But there are other adjuncts there to make it kind of comfortable as well. But she is phenomenal, and we were in office. We took less than 4 liters, and for 2 weeks you don't see any change, right? If anything, you might see weight gain, and I tell my patients that do not get on a scale for 2 weeks. You might even see weight gain because of the fluid shifts and the fluid retention. So give it time.
I know we're our own worst critics again, and having that history, I already know that, but I still did it.
Yeah. Well, I was probably not necessarily the most ideal liposuction patient, but being in this profession and having friends, you can get them to sometimes color in the lines. But I had gone through having to have a hysterectomy after having severe uterine bleeding and be put on tons of hormones. Right. I got pumped with 3 birth control pills a day, and I gained a significant amount of weight within a span of time. And at some point I decided really I got to do something about this. So I started to change my diet and exercise, and I had lost 14 pounds. And that's when I went to Dr. Gruber and I said, hey, I really need some help here to touch up some areas. And she said, okay, let's get you started. So I had my liposuction, and after a month of healing, I went back to the gym and I was a different person, because all of a sudden my little fat rolls didn't roll over my gym pants, and everything felt more comfortable. And after I lost another 15 to 20 pounds, but it wasn't because the liposuction took that away.
Right.
It was because it just got me so much more comfortable with myself that now I could continue on that weight loss journey that I was already in and on my fitness journey.
Right.
So it helped me tremendously to kickstart that. But I did have some excess skin because I had babies.
Right.
And it's sitting there. And our plan was, you know, massage that skin down. And if it becomes an issue, we remove it. And it's been 4 years and I haven't yet felt the need to get that skin removed because I'm happy with myself. But there's other things with liposuction too, like irregularities that you have to accept. But I haven't gone through the process. I think I can advise my patients a little bit better about it.
And I think, like I said, even with my liposuction, I think that Dr. Butala gave me back that confidence that I needed to get back into the gym, like you were saying. If you don't find me here, you'll find me at Pilates right now, trying to tone things. And I think that was just a nice jump start, knowing what I know, to kind of keep going with it. And my contour has never looked better. I am 36 and I have never had like that hourglass waist that I have now that he's helped me with.
Right. And that's exactly what it's for. It's to build that shape.
Right.
And defat a little bit, right? Oh, the other thing that I get on the liposuction myths are, can I never gain weight again? Or what happens if I gain weight? Well, you know, the fat that I took out, it's in the bucket.
It's gone.
It's gone. That fat is not there. But the way fat cells react is that they enlarge. They don't multiply.
They just swell.
They just swell up. So whatever is left, and there's no person out there, and it's impossible to take away all fat cells. I mean, there's a good reason you have fat. That padding's there for a reason. It regulates temperature. It provides a buffer to your skin and your muscles and your soft tissues. There's good reasons why fat is there. So we're using a blunt procedure to remove a certain amount, but we're not going to take out all of it. So whatever remains, it can swell. It can enlarge. So yes, you can gain weight. You can gain weight in areas you've had liposuction, but I'll tell you that at least my personal experience with myself and my patients is that you tend to gain weight more in other areas that haven't been liposuction than in the areas that you have, which is why BBLs, by the way, are a procedure where people are super happy to gain 10 pounds after their surgery, because wherever all the fat got removed,
it got put back.
Where it got put back on the bottom.
More.
It swells more on that bottom that's been replaced. And on the places where the liposuction was done more aggressively, they're going to end up getting an augmentation to their already augmentation. Yeah, exactly. So that's why it's so great.
Right.
Yeah. But a lot of body contouring patients do gain weight afterwards, especially if they weren't in a good routine beforehand. So I just pay attention to what people were doing before and tell them that they have to maintain that. There's only so much that I do. Right? Like there's what you do as a patient, what the surgeon does as a surgeon, and then the patient has to maintain that over time.
Right.